What is extubation? Extubation refers to the removal of a breathing tube, also called endotracheal tube. What is extubation? Extubation refers to the removal of a breathing tube, also called endotracheal tube.
Hi, I'm Allie Minzer, and I'm going to show you how to extubate someone. So first, when you receive the order, you want to make sure to verify it in the chart, and you also want to make sure to communicate with the patient's nurse and let them know that you're going to be extubating the patient, because you don't want them to walk in the room and be surprised that their tube's been taken out. So you're going to gather all your equipment. We've got an inline suction catheter, a Yankauer suctioner, scissors, and a syringe. I'm going to put on gloves, and then I'm going to make sure to maintain asepsis, wash hands, all that. Go into the patient's room, inform him of the procedure, introduce myself, explain the procedure, let him know that we're going to be taking his tube out. You're going to complete a baseline assessment. Since the order's already been placed, it's an assessment to see if he's ready to be extubated has already made, but before you extubate, you want to make sure to double check his vitals. You want to make sure to listen to his heart rate, listen to his breath sounds, record his SpO2, blood pressure, all that fun stuff. So I'll go ahead and take a listen. Okay, sounds good. I'm going to go ahead and also prepare the oxygen delivery device, which I'll be putting on him after I extubate him. And I'm going to go ahead and hyperventilate and hyperoxygenate him for 30 seconds before I suction him with his inline catheter. So I'll go ahead and suction. Pass the tubing down. Then I'm going to use the supraglottic Yankauer suctioner to make sure I get everything out. You want to make sure you have all the secretions out, because you don't want anything to be above the cuff, because he's going to aspirate that if you deflate it. So you want to make sure, it might be uncomfortable for the patient, and you make sure to let him know that, but just make sure you get as much out as you can before you actually deflate the cuff. Okay, now I'm going to deflate the cuff to see if I hear a leak. Okay, so I hear a leak, which means that he's okay to be extubated. I'll go ahead and reinflate the cuff at this moment, and I'm going to take off his Hollister device. Okay, this is really not the easiest. Should you? I need my assistant. Will you hold on to his airway when I take this out?
I will.
How do you get this? Okay. Okay, so it's been taken off. Alright, so have the patient take a deep breath, and also initially when I walked into the room I wanted to make sure he was sitting up, because you have to have him sitting up to be able to do this. So go ahead and take off. The inline, have the supplementary oxygen ready. Have him take another deep breath. I'll go ahead and deflate his cuff once again. Okay. Now, as I'm pulling it out, I'm going to have the patient cough. Cough, cough, cough. Okay. Okay. And the tube comes out. We'll go ahead and have the Yankauer ready. And make sure to add his oxygen. Okay, so he's got his oxygen. Okay.
Purpose. The purpose of this procedure is to remove the breathing tube from the patient's airway so that they are able to breathe on their own. What is done? The patient will be awake and cooperative and will remain on the patient monitor. They will be able to sit up if able to, and the breathing tube and mouth will be suctioned to remove any secretions. The cutoff of the breathing tube will be let down and the tube withdrawn. The patient may cough, but this is temporarily. What are the risks? It is uncommon to have a problem. However, some patients may have difficulty breathing once extubed. This occurs for a number of reasons, including acute airway swelling, breathing muscle weakness, and lung infection. Treatment. These patients often respond to treatment including nebulizing medication, physiotherapy, and suctioning or non-invasive ventilation. A small number, however, will need to be reintubated and placed back on the ventilator.
Today I'm going to be demonstrating how to prepare a nebulizer. We use it for the severe asthmatic and moderate asthmatics who there's no space are available on the truck. The dose is 1 gram and 5 mils initially. So make sure that the oxygen's off. Just grab your salbutable ankles and empty it into the container. It's more important that the oxygen's off, especially with atropine, because if it gets in your eyes, it can cause glaucoma and complications as well as the patient. And atropine is given together with the salbutamol in the chamber. Just attach the mask on top. Turn on the oxygen. Have it on 8 litres a minute. Just look for misting to make sure it's working. This just goes into the patient. More gracefully, hopefully, in real life. Now, once that's on, just make sure you can see that the mist is disappearing on inspiration, and that just gives a good indication that there's good tidal volume. If there isn't, it could be in for a few problems.